Now I am going to demonstrate an ECG of atrial pacing. Atrial pacing may be done either along with dual chamber pacing or very occasionally as isolated atrial pacing when in cases of sinus node dysfunction, AV node conduction is demonstrated to be perfectly normal. Advantage of using atrial pacing alone in such situations is that it avoids ventricular pacing. Ventricular pacing can produce dyssynchrony of the left ventricle and can cause left ventricular dysfunction in the long run. So there is an advantage in pacing the atrium alone. But the disadvantage is that if AV conduction disturbance occurs later, you will need a pacemaker revision. You can see a pacing artifact here and a P wave after that. So this indicates atrial pacing. There are some additional findings here. The P wave is broad and there is increased latency. That is, interval between the pacing spike and the P wave is slightly more. So this would indicate that there is some abnormality in atrial conduction. Atrial conduction system disease is there. PR interval is also prolonged and QRS is widened with a notch at the apex. So most probably these things would have developed later after the atrial pacing was done, because if you see a prolonged PR interval and widened QRS, you will not stop with atrial pacing. You will go ahead with dual chamber pacing. So in all probability this developed later. Now what about the P wave pattern in pacing? If you pace from the lower part of the atrium, P waves will be inverted in inferior leads as the activation spreads upwards. If you pace from the upper part of the atrium, P wave will be upright in inferior leads because activation is towards the inferior leads. And if you pace from the upper part of the atrial septum, that is junction between right atrial roof and the interatrial septum, then it is near the Bachmann's bundle to the left atrium. So simultaneous activation of left and right atria occurs so that P wave will be sharp, shorter in duration than sinus P wave and upright in inferior leads. If you pace from the lower part of the interatrial septum, impulses can spread rapidly to the left atrium through the musculature of the coronary sinus and also simultaneously to right atrium. This also causes a P wave duration which is shorter, but it will be inverted in inferior leads as the activation spreads from below upwards. So these are the different patterns of P waves in atrial pacing.